Um, and again, while I'm introducing her, if you don't mind putting your name and your contact information in the chat, that would be great. But Les Ford is from Ford Policy Solutions, and she's here today to provide an overview of recent changes to SNAP and welfare work requirements. And what I've asked her to do is to help nonprofits understand what's shifting and how these updates may impact the communities that you serve on a daily basis. So she is a little bit about Les. She is a policy researcher with more than 15 years of experience, including leadership roles as a domestic policy advisor to the president at the White House and a legislative advisor to Senator Mike Lee of Utah on Capitol Hill. Les is focused on transforming U.S. safety net policies to empower vulnerable citizens. She is now the president of Ford Policy Solutions and a senior fellow at the Alliance for Opportunity, where she focuses on state-led safety net transformation. She's also a member of the Virginia Board of Social Services, and she and her husband and their 4 children, I was reminded of that today when we were talking a little bit before this started, 10, 8, 5, and 1. I'm not sure how she has time to do all this important work that she's doing, but they live in Alexandria, Virginia. And before I turn it over to Les, I do want to thank, I'm not sure if Buzz Brockway is on the phone today. He is for sure at the Capitol, hunkered down, doing his policy work for the Georgia Center for Opportunity. But I just wanted to thank Buzz and the Georgia Center for Opportunity for the work that they do in Georgia as it relates to this very topic. And so I think you're going to hear more about the Alliance for Opportunity, which is sort of built upon their initial work. And Les, thank you for being with us, and we look forward to learning from you.
Well, thank you all for having me today. And I was looking at all of the programs that y'all put in the chat here, and I recognize a lot of the national groups, and I'm going to be looking up a lot of the Gwinnett County specific groups after this. And just know that I have so much immense respect for providers who are on the ground every day. I was just talking to Renee before this about the immense respect I have for y'all. So I'm just going to dive in and I'm going to get ready to share my slides here. Just let me know that y'all can see it before I get going. And I'm going to make sure that I can see it as well. Okay. Oh, let me go back here. Okay, so I'm going to call this the One Big Beautiful Bill as I'm going through it. It's had a lot of names. This is the bill that passed July 4th of last year, so 2025. It was a reconciliation bill. That means it only had to pass with 50 votes in the Senate, and it made a lot of changes. It extended taxes. It made a huge number of changes to SNAP. It made a huge number of changes to Medicaid. And a lot of those changes will have already started and will be getting implemented over the next year. So I just wanted to summarize in this conversation what that could be meaning for the people I think you are serving. So I'm going to go through a lot of those changes. If I'm going through something too quickly, feel free to just speak up, but we're also going to have a Q&A at the end. Some of it can be fairly wonky. I speak in acronyms all the time, and that is a huge issue. So interrupt me if I just say an acronym and I will try to stop. But just so you know what the Alliance is, the Alliance is a project of think tanks. In almost every state, there's a think tank. The Georgia Center for Opportunity is a think tank in Georgia. These folks, they're kind of the bridge between the local communities and the legislators in your state. And they really try to make sure that they're speaking to both and making sure that the legislators know what's happening on the ground with the providers. So that's their goal. And the goal of our alliance is making sure that the think tanks are speaking across states. So the Alliance for Opportunity, our goal is to move 1 million people to self-sufficiency, not just off of programs, but to self-sufficiency in 10 years by reforming the safety net, ensuring that the safety net is logical, that we are partnering with people in poverty, that we have a road, a pathway to self-sufficiency that is logical. Our programs don't always function that way. And so we, as policymakers, are partnering with people on the ground to make sure we do that. And so you see all the groups here that are in our alliance. That's a little about us. Okay, so what were the One Big Beautiful Bill changes? There were a lot in there. I'm gonna really stick to high level. If you have questions about something I'm not summarizing here, I have unfortunately read the One Big Beautiful Bill with thousands of pages, but I'm gonna summarize what was here. Okay, so we have expanded SNAP, that's Supplemental Nutrition Assistance Program, food stamps, work requirements. We have new Medicaid work requirements. Georgia is actually the only state in the union that really has work requirements before this passed, but we have new ones. We have a state SNAP funding increase. And I like to go through this because if the state is suddenly on the hook for hundreds of millions of dollars for food stamps, that does impact the downstream providers. It just does. Um, and then at the end, I am going to summarize ways for providers to really help out the people who are going to be impacted by these changes, ways to partner. All right, let's go through it. Why did Congress expand the SNAP work requirements? I want to make sure I explain what Congress was thinking here. You see the line, it goes up. There are a lot more people who are on SNAP than there used to be. There are about 42 million Americans before, you can't, unfortunately, my graph cut off here. Before COVID happened, it was down to maybe 37 million Americans. So in COVID, about 5 million more Americans needed SNAP assistance. There are about 1.65 million Georgians on the program. And this obviously means that there are that many people who are under the federal poverty level. So that would be about 130% of the poverty level. And the Congress kind of had the same reasoning in Medicaid. There are about 1 in 4 Americans are on the program. So when Congress sees 1 in 4 Americans on the program, high levels of need, they're like, that's a lot of people who are in poverty. And Congress's solutions to this is, well, we should get people back to work. It's kind of a hatchet solution, but that's the reasoning. So I want to make sure I explain that. All right, so who are they applying it to? Who is currently on the program and who are they applying it to? So in SNAP, in food stamps, we've always had a work requirement. It's that yellow wedge. They've expanded the yellow wedge to the gray wedge and a little bit of the light blue wedge, about 5% of that light blue wedge. It's not applying to disabled adults, and it's not applied to the elderly, and it's not applied to parents who have children under the age of 14. So if you have people in your population who are going to be in one of those categories, it doesn't apply to them at all. But if you have someone who doesn't have any kids, who's under the age of 65, or who has a child over the age of 14, that's who the SNAP work requirement is going to be applied to. I'm just gonna pause here because I'm gonna go to the Medicaid one next.
There is a question about this probably is related to your last slide. The population increase during, Teresa, you might have to help me with that. Can you come off mute and ask it, Teresa? Mind?
Yeah, what you showed the participation in SNAP going up pretty dramatically over time, but the population also increased. So
Yeah.
what does that mean as a percentage of the population, as opposed to
I'd
just
have
numbers?
I would have to layer it over there, and I've had it layered over there before, but the population did not increase as much as the SNAP enrollment increase. So I'm gonna have to do it over, but it'd probably look like this.
Okay.
I can get you the data in a graph via email after this, if that would be helpful.
That's actually okay. What I was looking for is the percentage of people in poverty bigger in relationship to the population. So more people are in poverty as a percentage of the population. Sorry, I'm being so
So
nerdy about this.
how we measure poverty, the number of people who are in poverty hasn't roughly changed since we started measuring poverty in around 1965 when Lyndon B. Johnson started measuring poverty. But the how how we have let people onto the eligibility criteria for food stamps has been loosened. Particularly in 2012-ish, there's something called broad-based categorical eligibility that let 5 to 7 million more people onto food stamps because of asset limitations. And so because of tweaks like that, more people have come onto the rolls. So it's a both and question.
Gotcha.
Our measurements for poverty haven't the number of people who are poor as we measure poverty hasn't changed, but more people have come on to the food stamp rolls.
Gotcha. Thank you.
Okay. And I'm happy to follow up via email. Renee, please give out my email. I will
All right.
give you all the links to all of this. Okay, next slide is about Medicaid. Okay, so one of the biggest things that Obamacare did was allow expansion enrollees onto the program. Georgia did not take advantage. It did not expand Medicaid. So this is a national picture, but you see that orange wedge at the bottom. This is a national picture. So this is the national picture of what happened to Medicaid is about a quarter of the Medicaid population is now able-bodied adults under about 138% of the federal poverty level. And this is who the work requirements apply to in Medicaid. These are brand new. And it's the largest driver of enrollee growth. So this is why Congress applied work requirements to this population. Okay, and I'm going to focus here on SNAP enrollment by household. Another reason why they expanded work requirements. So you see here, actually, when you're looking at SNAP households, that those who have children in the households are actually the ones who are working. Those who don't have children in the household or who are older are those who are least likely to work. So that's who they applied work requirements to. All right. Now let me get into the brass tacks. What are these work requirements? You've probably seen these in the food stamps before. It's 20 hours a week of work, training, education, or volunteer. So if they are doing a part-time load at a community college, if they are doing 10 hours a week with you volunteering, plus a 10-hour apprenticeship, if they are doing 5 hours at Subway and 15 hours a week at a community college, it's just 20 hours a week. That is what matters, is to get to that 20 hours a week. 80 hours a month, you can average it out over the month. And I kind of already told you who it applies to. Number 2 down here is waivers. This doesn't matter as much to Georgia, but half the United States used to be under a waiver, and that disappeared. Georgia used to not be one of them, as you can see. So about half the United States used to have a waiver from the work requirement, and now only 16 counties will have a waiver, in case you've heard of that before. All right, now the Medicaid work requirements as passed by Congress, they will go into effect January 1, 2027. So this coming January. And they were designed to match the SNAP work requirements. So 20 hours a week of work, training, education, or volunteering. And because Medicaid is a health program, they are slightly different. Again, they apply to able-bodied adults with children 14 years and over. It doesn't include the elderly, the disabled, or children. They have slightly more exemptions here. It excludes the medically frail, those with special needs, those participating in substance abuse, alcoholic, or rehab programs, and those who already meet the SNAP or TANF work requirements. So this is what is coming down the pike. And here I'm going to pause again because important to note here is that Georgia Pathways has already been in place since 2023. And y'all have the unique situation of being the only state in the union with active work requirements. So this has pluses and minuses. Y'all have a system in place and most states will falter at the start line. This is a very fast implementation period. This is really hard to start up. I'm sure you saw that in Georgia Pathways. So that's the positive. I think my next slide is actually a timeline of what y'all have been through in the past few years. So in 2019, y'all applied for a waiver in Medicaid to get that going. In 2020, it was approved. 2021, it was withdrawn. Y'all won a court case in 2022, and so it launched in 2023. You were not an expansion state, so this is a work requirement for work-capable adults up to 100% of FPL, the federal poverty level, and it began operating statewide. Now, here's where I do want to point something out. In your most recent waiver application that y'all sent to the federal government, y'all moved from a monthly check-in on that 20 hours a week or 80 hours a month to a once per year check-in. That will only last until the end of the year. I don't know what it will switch to. CMS, the Center for Medicaid and Medicare Services, they will be putting out regulations in June of this year, June 2026, and they will be telling states how often they will have to check for the 80 hours a month. I don't know whether it will be monthly or every 6 months. It's going to be one of those two options. It will not be once a year, I don't think. They will also be putting out regulations as to what we mean by medically frail or what we mean by substance abuse disorder treatment. That probably will be pretty clear, or what we mean by alcohol treatment. That probably will be pretty clear because of SAMHSA definitions. But those regulations will be coming out in June, and then Georgia will have to change the Georgia pathways to meet those regulations. So what we have right now, the annual check, will be switching as of January 1, 2027. So I just wanted to highlight that for y'all with what will be changing in the next 9 months. Any questions here? All right, I'm going to keep going. And again, why they do this? Because the first time they instituted work requirements, child poverty declined by 60%, and the employment of never married mothers rose from 46% to 62%. That's why Congress likes to do this. I don't know why I put this why slide here instead of the beginning. Sorry, y'all. All right, SNAP funding changes. This is another big switch that will hit Georgia's general fund quite substantially, so I wanted to cover it a little bit. There is a new food stamp state match. And this is based on the food stamp error rate. Every state has an improper payment error rate. I believe Georgia's is in the 15% category. So Congress said, unlike Medicaid, where there's usually like a 60-40 match where the federal government pays 60 and the states pay 40. The federal government pays 100% of SNAP benefits. So whatever you send out, whatever the state sends out the door, the federal government is covering all of it. That switched in the One Big Beautiful Bill for the first time. So, but it's based on how accurate the state is at their eligibility process. If the state has an improper payment rate under 6%, they keep their 100% federal match. But if it's between 6 and 8%, they're covering the state has to cover 5%. If it's between 8 and 10%, the state has to cover 10%. If it's 10%, they're covering 15%. So this can be a lot of money depending on how much benefits are being sent out the door. And no matter what, they are going to be their admin match is going to change. So no matter what, Georgia is going to be on the hook for $55 million more a year. That's a lot of money in a general fund. But they got even more money going out the door. And again, I'm going to cover the why. Why did this happen? Error rate shot up quite substantially, about 3 times. There was an error rate of about 3 times. So the states got pretty bad at checking who was supposed to be on their rolls.
Was that aggregate across the US, these rates?
This is aggregated across the US. There are about 8 states who have an improper payment rate under 6%. And this is every state's improper payment rate. And if you look at Georgia, they have a 15.65% improper payment rate. And that comes, if nothing changes in Georgia, when they have to start paying in 2028 or 2029, it'll be $554 million a year.
Ooh.
So putting those two numbers together, the 55 million and the 454 million, it comes out to about $510 million a year that's coming out of Georgia's general fund. And y'all know there are downstream effects of that much money coming out of a state's general fund. So I just wanted to highlight this for you so that you're aware that's a big pot of money. And I just always like to highlight it. That is a huge thing that's coming out. Every state legislator I talk to zeroes in on this. Now, the good thing is state legislators are also for the first time updating their eligibility systems. And when that happens, it not only drives down their improper payment rate, it also makes the system easier for beneficiaries. Instead of having a 42-page application, suddenly it's 5 pages and easy to get through. So that can be an upside.
Do you know, there was a question about when this change in the regulations gets implemented, will there be a special legislative session or to address the new regulations, or do you anticipate this would be part of the 2027 session that would address all of this?
This change goes into effect fiscal year 2028, which is, or 2029, depending on the year.
Yeah, okay.
So it goes into effect no matter what. The only difference is the state can choose which year's error rate they want it to be based on. They can choose fiscal year 2025 or 26. I anticipate most states will be choosing fiscal year 2026 because that will give them the most time to drive down their error rate.
Okay.
All right, so we've come to my last slide, which is ways to help. Oh, sorry about that. So the first way is to create volunteer options. Volunteer hours count for someone who's in one of these categories where they want to keep their health insurance and they may not be currently work capable, even though they fall into a category where the federal government or the state says they're work capable. And so if you have an option to create volunteer hours, meeting with a caseworker counts as a volunteer hour. Any hour in person counts as a volunteer hour. So if you're meeting one-on-one with someone or meeting in a group with someone or they're coming to an education hour where they're learning about budgeting or food preparation, that all counts as volunteering. Education also counts. In the same bill, there was short-term Pell Grants was passed, which is for the first time, it allows Georgians to access federal aid for short-term career-focused training programs. Pell Grants have been traditionally used, it's about $7,000 a semester for someone to go to community college or go to an in-state school. For the first time, you can use it for an 8-week program or a 15-week program if you want to be trained to be a CNA or some sort of easy access career program. These should be launching July 1, 2026. So if you wanted to make sure that your center is an access point and able to sign folks up for some sort of education, that is a great way to have someone meet their work requirement. Even something like connecting with your local employers to make sure that you're helping with folks with resume skills, with interview skills, with basic, and all the caseworking that you do with resume skills, with interview skills, with transportation assistance, all of that counts towards their hours. So the work you do, sorry, go ahead.
Oh, I'm sorry, I didn't realize. How do we make sure we're one of the facilities that can do that? I mean, we do it already, but that we can count those hours for them.
So I think key to this is connecting with Georgia Medicaid. So Georgia Medicaid will have to have forms for you to for the individual to fill out their work requirement hours on a monthly basis. And this brings me to my number 4, which is application and redetermination assistance. I would say, so I work for I'm on the board of social services in Virginia, and in the social services of Virginia, we have a training assistance corps, and the training assistance corps obviously trains all of our eligibility workers, but we also allow our training corps to train our providers who are on the ground in order that they know exactly what the beneficiary has to do to fill out applications and fill out work requirements. So I think contacting, I think your director of Medicaid is Stuart Portman, and he has a great team around him. So I would say contacting Georgia Medicaid and saying, we have we have all the providers in Georgia, and we would like to be trained on how to assist folks with the applications, how to assist them with redeterminations, how to assist them with filling out work requirement hours. And we would like to ensure that we know how to fill out volunteer education and work requirement hours as well. I think that would be ideal at this juncture so that when January 1, 2027 comes, that you have the skills to be able to walk alongside people in that process. Again, I don't know Georgia specific things, but I know that in Virginia, we're trying to line that up.
Do you know of any grants that the federal government's going to offer to help offset that? Like if we wanted to hire more people to help individuals, qualify for the volunteer and so forth?
I don't know of a specific grant here. In the grants that might be available would likely be through your TANF program, if anything.
Okay.
That would probably be the most flexible.
Tiffany, if you don't mind, I see your comment. We've been trying to do that with Georgia Medicaid for years. Do you want to
No.
expound on that at all?
Please tell me more.
Sorry, I had to unmute. Yeah, we've reached out several times about being trained to help our patients go ahead and just apply for Medicaid while they're in the clinic, to be able to assist them with that and kind of take that over and take that off the plate of all the caseworkers that are overwhelmed. We have not been able to get anywhere with it, but again, that's just something we have been wanting to do. So I'm gonna reach out, you said that, to Stuart Portman.
Mm-hmm.
Yeah, and see if he could help us. It just makes so much more sense while they're in the clinic to do that. Now, I will sit down with them and go through their gateway application for them and with them. But we'd love to be able to just kind of take that off. What we're finding is that they're 3 and 4 months behind in Medicaid approvals, and when we're dealing with prenatal patients, it's creating a huge hardship for them to start their prenatal care without being I mean, we'll allow them to start without being self-pay, but other offices won't. And so yeah, that's just something we've been trying to do for a long time.
And this is what we have seen in Georgia Pathways is, and Georgia Pathways was for able-bodied adults, but that's why they went from a monthly 80 hours a month check to an annual 80 hours a month check because they got so backlogged in the checking process. So there are a lot of concerns that, I mean, Georgia's been doing this since 2023, but now we have 49 other states launching in 2027, a whole new system. So there are a lot of concerns about a backlog existing.
Yeah, because prenatal pregnancy Medicaid used to have to be approved within 10 business days. And technically, I think that's still the requirement, but it's taking months. And that's been since COVID. So
Gotcha.
it's been ongoing for a few years.
Yeah, and I'm not sure why they wouldn't respond to you at all. That's concerning. And maybe hopefully there would be a difference between signing folks up for Medicaid because versus let me help you get your work requirement done. But no matter what, there should be some engagement from the community. So if it's not Stuart, it should be someone in his office.
Okay, thanks.
Yeah.
Tiffany, I think, are we coming to the point where we can open it up for questions? Do you have any other?
Yeah, that was my last slide. Apologies.
I would no, that's fine. I thought it was, and we had talked a little bit about a question that I have. And Buzz Brockway is on the line. Thank you, Buzz, for dialing in, even though you may or may not be able to actively engage. I do see your comments in the chat, so thank you for that and for facilitating this call today, making it happen. So Buzz and I have often talked about the benefits cliff and the work that they've been doing at the Georgia Center for Opportunity for some time now. And I guess I'm trying to figure out how do these changes in terms of trying to help people gain economic mobility by increasing their income sometimes gets crossways with the policy around who's eligible for what benefits, and there's a gap that occurs that really um it's not what do you say when it's a disincentive to actually
Yeah.
moving up the career ladder and making more money because there's so many benefits that you just can't fill the gap along the
Yeah.
way. So what would be your thoughts, your guidance around that kind of a question?
Yeah. First, I'll share in the chat a paper that the Alliance for Opportunity wrote with the American Enterprise Institute, and it's called Stranded by the Safety Net. And it kind of goes into explaining exactly what we mean by a benefits cliff. And I'm sure all of you have seen it in practice. You have a mom with two kids and she's making $15 an hour, and then she gets an incredible raise and it gets her up to, $28 an hour, and it gets her cut off from a childcare subsidy that she desperately needs in order to go to her job. Or it gets her cut off from $200 worth of SNAP benefits, or her Medicaid's gone, but she now has to apply for CHIP for her kids, or something like that, where she makes more money, but it cuts off an essential benefit that made her life function. So that's what we're talking about when we're talking about benefit cliffs. If you've been on the ground, you've seen it. I've seen it, and I'm not a provider. So, and in both the programs we're talking about, there is a benefit cliff in both of these programs. SNAP has one, and there are significant reasons why SNAP has one. SNAP was not intended to have one. When SNAP was created, it was intended to have a 30% gradual decline, so that with every extra dollar you made, you were supposed to only lose 30% of SNAP benefits. Medicaid is different. Medicaid is an on and off benefit. You either have health insurance or you don't. And so once you go over 138% of the federal poverty level and you get checked at your redetermination, you either have health insurance or you don't. And so that one's a lot harder. So there are two things that I think can be helpful. One is on the front end, especially as someone's coming in and they fall into this category of an able-bodied adult who is subject to the work requirement. The front end counseling is so important. And I get you're dealing with folks who are extraordinarily vulnerable. They've experienced a lot of trauma if they're in this space where they're talking to you. And so having the conversation about budgeting, this is not an easy conversation. So I'm putting all that out there with an acknowledgement. But the front end conversation, when you're mapping out what does it look like to get one of these short-term Pels and to go back to school, and what does the hourly wage look like if I get a job in this field? There are tools that are available pro bono that you can map out. Okay, how can we get over if my SNAP benefits goes down by $100 and I'm only making $50 more? Very often it is in our survey work, there's survey work by the Sutherland Institute. What we found is there's a greater fear, and when you walk through what will happen, you are able to plan it out a little more. Again, we're talking about a population where this is really difficult. Someone asked, does able-bodied mean someone who's not receiving disability benefits? Yes, able-bodied means someone who's not receiving disability benefits. Meaning they could be disabled if they're not formally on benefits. Mental health reasons for disability. I'll answer the second part in a second. Okay, the second part that could be helpful to get through a benefit cliff, especially with Medicaid, is there is a bridge into Obamacare coverage. So as you're coming off Medicaid coverage, you are able to get on Obamacare, but it requires someone to kind of hold your hand and to If you've ever, I'm on Obamacare. If you've ever logged onto the marketplaces, it's kind of a scary process. You're like, okay, what's a deductible? What am I getting an EPO and HMO? How much is this going to cost me? What is my annual income? Walking through all of those questions can be a scary process. Having someone hold your hand and say, okay, you are making 150% of the FPL, whatever that is. Like if you're a single person, 32 grand a year, you're not going to be paying anything in a premium. All right, but you are going to have a deductible. That's 3 grand. So that's 3 grand a year. So if you go to the hospital, you might need some savings for that. Walking them through what all these terms mean is a very helpful hand to getting through the benefit cliff that exists in Medicaid. There are ways to get through it, but it's the explaining process we have found is the way to get through the cliff. I'm going to answer this one from Teresa. She asks, does able-bodied mean someone who is not actively receiving disability benefits? Yes, it does. Meaning they could be disabled, but they are not formally on benefits. They are considered able-bodied. Does that in turn include mental health reasons for disability? So there are mental health reasons for being on SSI or SSDI. There are also exclusions within the law, within the One Big Beautiful Bill, mental health reasons. So if you're in active recovery or active participation in substance abuse disorder, alcohol addiction disorder, if you are in active treatment, that would exclude you from being able-bodied. But if you just have an addiction, that would not. There is a exclusion for medically fragile. CMS is currently working on how that is defined. That is probably the biggest thing we're looking forward to in June is how is that defined? We are almost certain that it is going to require a doctor's note. So if the doctor says, hey, this person requires 5 hours a week of medical care, that would be an exclusion. If they are not actively receiving medical care, as in they have so much depression that they are not able to get medical care, that would probably not be an exclusion. They will need to get to a doctor. So it's going to require documentation is what I'm saying.
The question was my question. Okay.
But
Who else has a question for Les? You can either place it in the chat or come off mute. Who's responsible for walking individuals, like you were just saying, walking them through the choices and hand holding them? Ooh, I know that takes a lot of time, right? Whose responsibility is that in this current environment?
Oh, is this the question to me?
I think so. Yeah. I mean, is it
Yeah.
nonprofits? Is it providers of SNAP and Medicaid benefits? Is it the Stewart's office? I mean, who does this?
I would say it's the people I'm looking at. So Stewart's job, Georgia Medicaid, his job is to get the benefits out the door and to ensure that the person in front of him qualifies for the benefits.
Mm.
And that is probably how he views his job.
Mm-hmm. But not the execution and bringing it all together so that that person can, you know what I'm saying? There's a lot.
Yeah, there's a lot here. And I think that is so. There are a lot of states who are looking and they see this caseworking. There's a difference between an eligibility specialist and a caseworking specialist. And there are states who are beginning to pull these two things apart and realize, oh, these are two different things. So, for instance, in Arkansas, they are dealing with something called Hope Hub, where they've pulled apart the eligibility piece and the caseworking piece. And they also have realized caseworking isn't necessarily something states are good at. Maybe states can fund it, but it isn't necessarily something states are good at. So Hope Hub, it's on the ground, and I think it's expanded to 19 counties in Arkansas. And so when it goes into a county, the person who takes control of it in the county, has to go out to every person in the county who would need to be part of that individual's life, whether it's the fire station, whether it's the ER, whether it's that local housing provider or the local domestic violence shelter, or whoever would be involved in assessing someone who's vulnerable. And it has to be an individual who agrees to be a part of Hope Hub. And then when someone who's vulnerable comes into any of those facilities, you have to assess them according to like 13 measures of vulnerability. Housing. Are you homeless? Do you have stable housing? Childcare. Is your child with you all the time, or do you have access, or with grandma who's kind of ill right now? Do you have access to stable childcare? On and on and on. Do you have no food in your cupboard? Are you employed? All I'm saying is, I think the point you're raising is a very valid one. Caseworking is so incredibly important, and it is a separate function than the one that the state, Georgia Medicaid, Georgia Pathways is currently performing.
Mhm.
So I take that very seriously, and I take the point that was currently raised about grants, because this isn't a free function. You can't just go to work and do this. This isn't a pro bono activity.
All right, a couple questions before we have to let you go and then save time for some conversation amongst our team here, which you're welcome to stay for. But number one, you referenced some tools, I think originally, and I'm not sure if those tools are able to be put in the chat, but there's also a question about tools or websites for the conversation of walking residents through the medical options or SNAP changes. And I'm thinking about this maybe in Kentucky, or I'm not sure where you were just referencing, where they sort of have a process down. Maybe that's a benchmark. Maybe we could research in our own community. So that. And then Adonis says AmeriGroup has employment specialists that support members that may qualify with Georgia Pathways and connect with other resources. Hope Hub. Yeah, that's it. Thank you so much for that, Les. Arkansas. Thanks, Jacqueline. And Shannon, I may have seen your hand raised, although I think it's down now. Do you have anything, a question or? No. Okay. That was a bit ago. All right. One final question. Oh, somebody, oh, that was me. That was my hand floating on the screen. Anything else for the good of this conversation about upcoming SNAP and Medicaid changes? I feel like we got the lowdown in a pretty.
Can I ask?
Yeah.
Can I ask the question?
Sure, Danielle.
My question is, I'm just trying to figure out if someone can just help me understand. I know not directly, but indirectly, the role and the role that schools will play when it comes to this. I know we talked about a little bit about the community colleges, but I'm also interested in how it actually relates to K-12 and supporting parents and families when it comes to what will be happening soon.
Yeah, if the child is under 14, the work requirements should not apply to that family. So I think the population that would be impacted would be maybe a high schooler. So the parent of a high schooler could be asked to work 20 hours a week or 80 hours a month. And in that case, I think if the parent, I mean, I don't know that the high schooler would need access to childcare or after school services. Maybe in that case, we would, if the child had some sort of disability, but they might have an exemption if the child had a disability like autism. I assume the parent would have an exemption from the work requirement. And so if the child didn't have that, then the parent would be asked to work. So you might need to partner with a school to open up volunteer or work hours for parents. That might be an option. I think the danger would be if SNAP benefits were cut off for those parents, what would happen to those kids? And whether you'd want to increase breakfast and lunch for those kids. I don't think they're cut off completely. I think they would be reduced for the parent portion, but reducing SNAP benefits for any household impacts the child, obviously. And if the Medicaid portion is, if the Medicaid for the parent is cut off, that child will probably be on the CHIP portion, and so would not lose their Medicaid. But if a parent loses their Medicaid coverage, that obviously impacts the family's finances. So we're going to be looking at the family's finances in two ways, through food coverage and just medical bills. I would be looking at those two things.
Well, Les, thank you so much for taking your time today. We had a presentation in November on the tax side of this
Oh, good.
bill. So that was taken care of. And then you're bringing this whole SNAP benefits and Medicaid, and we really appreciate it. It's a very complex topic, and you did a great job of kind of breaking it down into language we might be able to understand. Also appreciate Buzz Brockway for making that connection for us. So between the Georgia Center for Opportunity, who I'm sure is the most amazing member of the Georgia Alliance, or the
They are 100%.
we like to do things the right way in Gwinnett. So anyway, Les, thanks so much. You're welcome to stay
Thank you
on.
for having me. I do
Yeah.
appreciate it, y'all.
And I will, we'll try to find a place to post these slides on the website when communications director gets back in town.
All right. Thanks, y'all. I hope you have a lovely day.
Bye.
Bye.
All right. For the rest of us, any general announcements or things that we need to be aware of? I think that's fascinating. I don't know what it would take to sort through all of that to understand what she was able to distill down for us today, but I'm grateful for that opportunity to have her with us.
My main concern is the capacity that the nonprofits, we have to assist families, especially that some of the grants that we have, they require a matching. And I think that we need to encourage the state to find a way to increase the capacity of nonprofits to serve families and take away the matching requirement, because this is a lot of work and a lot of dedication, a lot of changes, and the funding to provide services is not there as it should.
Mm-hmm. Other thoughts? I agree with you very much. Eli? Any other events that are coming up that we need to be aware of?
Renee, I think, we have our summit tomorrow. Gwinnett County does, One Stop for Help. If you haven't received an invitation, please message me. This is Jacqueline Hughes with Gwinnett County. I'm happy to send you one. We still have seats open.
And this is continuation,
Coordinated care.
coordination of care. There you go. It's
Summit for Gwinnett County.
Yeah, the centerpiece of this conversation, I think, is going to be around the Unite Us platform and how we are all engaging in that, how it's working, and how that might be a tool for us to be better at that coordination of care for residents. So if you're, be sure to message Jacqueline while she's still on the phone. Adonis.
Yes, hi. Hello, everybody. Yes, AmeriGroup is hosting a spring event. It's going to be at the One Stop with Norcross, One Stop Norcross, Georgia. This Friday is going to be activities for the kids. We're going to call the community. The Easter Bunny is going to be there. We're going to have some goodies, and they can take pictures. The Head Start kids are coming also. So that's for Easter activity.
Okay.
Also, April. No, the next one is going to be April 17. Yes, is the third Friday of the month. Is the cooking demo also with One Stop Norcross. Thank you.
Yeah, you're very welcome. Anything else? You'll need to come off mute while I'm typing one thing in the chat for next month's All Call. And if there's not, I will just share with you that we will have next month, we're going to feature Building Babies' Brains. So Kim Holland and the collaborative that has been doing such great work for early childhood learning in Gwinnett. And there's quite a few of them that have they're just stellar in terms of collaborative and working through all of this. So that is our focus next month. And we invite you to kind of This is always the same link. But that's what will be featured on the 27th of April. So there's ways that we can support this, and y'all, I can't emphasize enough how important it is that we care for our little ones, ages 1 through 5. 90% of our brain is developed during that time period. So we all, just like building resilience and preventing trauma in our kids, this is equally important, and we invite you to be part of that.